Hi, welcome to Community Connections. I'm Sandy Dyke, your host. I am the administrator with Arizona Care Hospice. For those of you who might be joining us for the first time, welcome. Today we're going to actually just kind of sift in a little bit to what is hospice, who is Arizona Care Hospice, and just tackle some of those questions that kind of linger out in the community that we often face and hear as we're going about supporting our families in the community in general. So first off, who are we? Who is Arizona Care Hospice? And yes, there are many hospices in the community that one can choose from. However, Arizona Care Hospice, we are locally owned and we are here right in the community. We are only in Arizona and we live and breathe the community. We are in Prescott, we are in Payson, and we're in the greater Phoenix area. So no matter where you're at in those general population areas, our team is here to support you at the local level. A lot of times people say, well, what exactly is hospice? Hospice can be a very scary word for some, and sometimes it's something that people want to avoid and they don't want to talk about. And so today I just want to have just a real general conversation about what hospice is and just clarify maybe some of those misconceptions that are out there as well. So hospice, to keep it simple, is a Medicare benefit. It's covered under Medicare Part A. And the scary part where people kind of want to steer away from is the true Medicare guideline and definition of hospice. Basically, per Medicare, somebody qualifies for hospice if they have a life expectancy of 6 months or less, as deemed by a physician, if that disease follows its normal course. So let's break that down a little bit. A lot of information right there. And the thing is I like to keep it simple. People can have life-limiting illnesses, whether it be a cancer diagnosis or congestive heart failure or COPD, Alzheimer's. And so these are all diagnoses that we look at from a hospice standpoint in order to qualify somebody. Now, people that have these diagnoses, if they're looking to take aggressive measures to their care, meaning they still want to go to the hospital, they want to seek procedures or surgeries or treatments to possibly cure even their medical condition, that is not something where hospice would come into play quite at that point. Hospice is something for those with those diagnoses that are not wanting to take those aggressive measures. They're just wanting to be comfortable and have as much quality of life as they can and still be in touch with the medical needs that they might have, but in the comfort of their home. So when it comes to hospice and why should somebody choose us, or how does somebody even go about starting the process of seeing if they qualify for hospice? Again, a lot of questions that people have. And really, the first thing I always recommend is just starting the conversation. Whether it's Arizona Care Hospice or if you're listening to this in another state, wherever your local hospice is that you may be familiar with, just simply have a conversation with them. It doesn't hurt to get information. It doesn't hurt to get educated. And that just makes you a better advocate for either yourself or for your loved one that you're inquiring about. And so with hospice, again, it's really that comfort seeking measures, quality approach to care. And so with hospice, you have an entire team available to come into your home. You have an RN, you have a CNA who is a home health aide, you have a chaplain or spiritual support, you have a social worker as well as a medical director who oversees the entire plan of care for the patient, and you also have access to volunteers. So And the key word there is access. Per the Medicare guidelines, the only person a patient really needs to have come in under the hospice benefit is that RN. So they have access to a social worker, they have access to a CNA, but that doesn't mean they have to have all those individuals coming into the home. It's something that's there available to them. And so we, hospice, come into the patient home. We meet that patient wherever they call home, whether it be a residential facility, whether it be a private home, whether it be a senior living community. We provide care, hospice care, to those that are homeless. Wherever they call home, that is where we go to provide that care and support. Again, it's a conversation that has to start. There has to be a mental state of mind by the patient, because it can be a very scary next step in somebody's care and somebody's diagnosis and that journey that they're on. And so not only do we want to ensure they meet the black and white criteria, so to speak, of Medicare, we want to make sure that they and their family members are really mentally prepared for that hospice journey. And that's where the team comes in. That's where we have those conversations to better understand how we approach their care going forward. There's a lot of misconceptions out there about hospice. People think that once they go on hospice, they're going to pass in the immediate near future. That could be days or weeks. Not always the case. Yes, depending upon the individual, it could be. But again, it's so individual. People can be on hospice for months. It just depends on their individual situation. And that's where, as a team, we meet with the patient and those that they want involved in their care to better understand where everybody's at and what their specific care needs are. And so, there's a lot of gray area too to hospice. And a lot of people think that if I go on hospice, that's going to accelerate the dying process. Not true. If anything, studies have been done where those that are on hospice, it actually extends their life expectancy. I'm not going to say it extends it by years, but there is some quality to going on hospice, and that you have that additional quality time. It turns out that when people have hospice coming into the home, they're getting an additional benefit to their care that they wouldn't typically have. And they're finding it maybe easier to go about their day-to-day life having those supports in place. And so it's not so much of a struggle that they may be experiencing currently without that assistance. So at this point, you may be wondering, do I qualify, or does my loved one qualify, and how do I get started? So the best thing to do, honestly, is to call us. You can visit us at our website at www.arizonacarehospice.com. When you visit that site, you will actually have access to all of our location and their contact information. But once you do that, once you make that initial phone call, you will be connected with somebody immediately that can discuss your situation and really understand the individuality of what's going on with you or your loved one. And the nice thing is that we are 24/7. You don't have to call between the hours of 8 and 5. I know so many times the adult child is caring and looking out for their aging parent, or it just doesn't work in somebody's schedule to make a call between that 8 and 5 hour of typical business hours. So just know we are 24/7, and there's always somebody to take your call and answer questions you might have. And so what does that look like? After you make that call, some of you might be thinking, well, is this a quick process? Is this, getting a lot of information gathered? And so basically what we do is we go through that hospice benefit with you at a level and in terms that everybody can understand. We're not going to be using a lot of clinical terminology, so to speak. We are going to just have a regular conversation with you. And so basically, once somebody contacts our office, as they think they might have somebody who qualifies, we then connect with our clinical team. And what we do is we will gather records. Again, we do all this for you. We gather the records, we check the eligibility with the Medicare benefit or even with a private insurance if that's the case. And we schedule time for our nurse to come out and do an assessment with you or your loved one. And it can be as quick as that same day. It can be whatever is convenient for the individual calling. And the thing too, which I want to make sure to mention is we have so many folks that we help that and support that don't live at home. They live in an they live outside of a private residence. They live in a senior living community. And it's so important for whatever hospice you're working with to have a really good relationship with those different organizations, because you are going to want and need to partner very closely to ensure that the care is delivered together to that individual and that it's delivered timely. So again, just something to kind of keep in mind. That is something that we at Arizona Care Hospice do. I would say probably about 50% of our patients live in private homes, 50% live outside the private home in other organizations or settings. So at this point, you may be wondering, why choose Arizona Care Hospice? And so just to wrap up some things and support that is Arizona Care Hospice is local. We are locally owned. We are ingrained into the community. Many of our team members have gone through hospice with our loved ones. Many of us understand what families are going through. We understand that every situation is individual, and our experience or somebody else's experience, it will not be like another's experience. Everything is individualized. And so our team is there to help on that journey for both the patient and their loved ones. And so, when you're looking to make that call, again, your care is our passion. We are here to support you on that journey, however that may look, and answer whatever questions you may have. Today was really just to kind of clear up some misconceptions out there, provide some basic knowledge, understanding, and help you be a better advocate for yourself and for your loved ones. Thank you so much for joining us today for this episode of Community Connections. If you haven't already done so, we would appreciate if you would subscribe. If you're listening to us on YouTube, feel free to like and, of course, always share. We always want to help spread the education and information to the greater community, so we appreciate you sharing this as well. We look forward to you joining us next time on Community Connections. I'm Sandy. I am your host with Arizona Care Hospice, and we look forward to seeing you the next time around.